November is Pancreatic Cancer Awareness Month. It's an important time to bring awareness to one of our nation's deadliest cancers. If you or a loved one face a diagnosis, we are fortunate to have skilled professionals right here in the Valley. Joining us now to discuss pancreatic cancer is Doctor of Nursing Practice, Nikki Campagna. Doctor, welcome in.
Thank you.
Well, it's great to have you. Thank you for spreading awareness, and you are wearing purple, as am I, because this month really it's about having the conversation. What do you think it is most important for people to know about pancreatic cancer?
I think most importantly, it's important for them to know the risk factors, know their body, because there are a lot of subtle changes that they may not realize what exactly is going on. And the thing of it is, the reason why it's so subtle, they don't notice what's going on, is the pancreas is so deep inside the body. There's organs in front and behind it. So everything is pretty subtle. So unless you advocate that something is truly going on, you could be diagnosed pretty late in the process.
Okay, and early diagnosis, I would imagine, is key. So
it is.
Let's talk about some of those signs, some of those symptoms that people can be aware of. If they're experiencing them, you want them to get into their doctor right away. What are those?
Well, one of the primary ones is subtle changes in pain. It could be abdominal pain, it could be back pain, and it's very hard to describe because it kind of comes and goes. Another thing is diabetes that came on all of a sudden. Another thing is loss of appetite, unexplained weight loss, and some may have their skin turning yellow.
That's a very interesting symptom. That can also be described as jaundice as well,
True.
Can't it? Yes. So any of these symptoms, it's good to go in and get tested. I mean, is this a regular part of a regular checkup, you think, to test some of these symptoms? Or what do you actually go in and get tested for when you're looking for pancreatic cancer?
It is not part of a regular exam. It's usually a focused exam because the patient comes in due to these complaints. So it's not part of like a wellness exam.
Well, and quite frankly, it's part of the danger of the disease is that a lot of people don't detect it early enough because these symptoms can't hide.
It's true.
Yes.
80% are diagnosed in stage 4.
80%?
Yes.
My goodness, interesting. Does it run in the family as well?
It does. Genetic history is one of the risk factors, so it's really important to know your family history. Another risk factor is chronic pancreatitis, diabetes that you've had going on for over 5 years, so it's really important to have your diabetes under control. The other thing is race and ethnicity. We know there's a higher incidence in men. There's also a higher incidence in the Ashkenazi Jewish population, as well as African Americans.
Interesting. Good things to watch out for. OptumCare provides cancer treatment right here in our valley. In fact, I believe you have a new clinic.
We have a clinic opening up on Rancho in Charleston in the medical community, and that'll be opening up in December.
That's great. No, that's great. It's so great that our medical care is expanding here in the valley. It's been needed for some time. What can people do to support people who do have pancreatic cancer? What's it like living with a family member who's undergoing treatment?
It can be very difficult and stressful at times. I've been working in oncology since 2007, and it hit home for me in 2014. My brother-in-law was diagnosed with pancreatic cancer, and he was diagnosed in February of 2014, and he was gone by November of that month. So it hit pretty close to home. So my promise to him and to myself and our family is to do more to improve outcomes and to focus on early diagnosis and screening tools.
Oh, I'm so touched to hear that, and good for you for turning your pain into something that is helping other people. Sometimes it just seems like we have no other option but to do that in life. I hear you. In March, there's something to look forward to, the PanCan Purple Stride 5K, that I know is quite an event here in the Valley.
It is quite an event, and this year is our 5th year, so we're celebrating it big.
Great.
OptumCare Cancer Care is proud to be a presenting sponsor of it. They truly support the community, and this is a good way to unify the community and improve outcomes for our patients, so it's a win-win.
All right, great. Well, we want people to sign up for that. Thank you so much for spreading the awareness.
Thank you.
Today. November is Pancreatic Cancer Awareness Month. For our expertise, compassion, and understanding, OptumCare Cancer Care is there to help. Go to the website listed for more information on how. OptumCare Cancer Care is a proud sponsor of the Morning Blend.